So when people have their first injection, there's a few different things they worry about. First obvious one is, does it hurt? It doesn't hurt, you don't feel sharpness. It's quick and you feel sudden pressure in your eye. The drops make your eyes numb, and you only need a few of them to make the eye numb enough for an injection. And the commonest thing that people say after their first injection are words to the effect of, "Is that it?" The other things that people worry about is how they're going to keep their eyes still. And that actually is an important thing, which is why we have a specific target on the ceiling for you to look at so that you can keep your eye absolutely rock steady before the injection itself. So people also worry about how they're going to keep their eye open. We don't use a thing called a speculum, which is a wire thing to hold your eye open. We just gently pull your eyelid down and give the injection quickly. When you have an injection, it's very important that you can't drive home straight afterwards. It's extremely important to get someone to take you home. Whether that's a carer or a taxi or Uber is completely up to you, but you definitely can't drive home. In fact, it's probably best not to drive for a few hours at the very least. On the way home, it's best not to have the air conditioning or the blower air blowing into your eye, because initially your eye is still numb. So what that means is that you might end up drying your eye out. So the best thing you can do is have the air conditioning not blowing in your eyes, windows shut, and even close your eyes if you can. In fact, the best thing you can do after an injection for an hour or two is to keep both eyes shut. One of the biggest risks of injections is infection, so we take that seriously and put antiseptic in, as well as take all other precautions. For most people, the risks of injections, which is 1 in a few thousand of getting an infection each time, is much lower and is an acceptable risk compared to the risk of not having injections. For macular degeneration, if you have injections, you've got a 95% chance of keeping the vision you've got or actually improving.